Nipah virus is a dangerous germ. It is one of the many viruses that have the potential to cause severe illness in humans. This virus is particularly concerning because of its high mortality rate and the lack of specific treatments or vaccines available. It can make people very sick. Symptoms can range from mild to severe, including fever, headache, drowsiness, and confusion. In severe cases, it can lead to encephalitis, which is inflammation of the brain, and can be fatal. Nipah comes from animals. Scientists call this a zoonotic virus. Zoonotic viruses are those that are transmitted from animals to humans. This type of virus can be particularly challenging to control because it involves multiple species. This means it can spread from animals to humans. The transmission can occur through direct contact with infected animals or their bodily fluids or through consumption of contaminated food. Bats naturally carry the Nipah virus. They don't get sick from it. These bats, particularly fruit bats, are the natural reservoir for the virus. They can harbor the virus without showing any symptoms, making it difficult to detect and control. But they can pass it on. The virus can be shed in their saliva, urine, and feces, which can contaminate food sources or be directly transmitted to other animals and humans. Pigs can also get infected with Nipah. They often get sick from it. Infected pigs can show symptoms such as fever, respiratory issues, and neurological signs. They can then transmit the virus to humans, especially those who work closely with them. Nipah is a serious threat. It can cause deadly outbreaks in people. Past outbreaks have shown that the virus can spread quickly and cause significant morbidity and mortality, leading to public health emergencies. That's why it's important to understand this virus. Researchers are working tirelessly to study the virus, understand its transmission dynamics, and develop effective countermeasures. We need to know how to protect ourselves. Simple measures such as practicing good hygiene, avoiding contact with sick animals, and ensuring food safety can help reduce the risk of infection. Knowing about Nipah helps us stay safe. Public awareness and education are crucial in preventing the spread of the virus. By understanding the risks and how to mitigate them, communities can better protect themselves. We can take steps to prevent it from spreading. This includes monitoring and controlling animal populations, improving surveillance systems, and ensuring rapid response to outbreaks. We can also get the right help if we think we've been exposed. Early detection and medical intervention can significantly improve outcomes for those infected with the Nipah virus. Healthcare professionals play a key role in managing and treating cases to prevent further spread. Nipah virus can spread in a few different ways. One way is through direct contact with infected animals. This could be through bites, scratches, or even just touching them. Another way Nipah spreads is through food. For example, eating fruit that an infected bat has touched can be risky. The bat might have left saliva on the fruit, contaminating it with the virus. Finally, Nipah can spread from person to person. This happens when someone who is sick with Nipah coughs or sneezes. Tiny droplets containing the virus can travel through the air and infect others. Understanding how Nipah spreads is crucial. It allows us to take precautions and prevent the virus from spreading further. Nipah virus can cause a range of symptoms. It often starts with a fever. You might feel hot and feverish, like you have the flu. Headaches are also common. Your head might ache, making it hard to concentrate. Nipah can also affect your breathing. You might develop a cough or have trouble breathing deeply. Some people experience more serious symptoms. These can include confusion and seizures. In severe cases, Nipah can lead to encephalitis. This is a dangerous swelling of the brain. It can cause coma and even death. If you experience any of these symptoms after potential exposure to Nipah, it's vital to seek immediate medical attention. Once someone has Nipah virus, they can spread it to others. This can happen through close contact with bodily fluids. For example, touching an infected person's saliva or blood can transmit the virus. Respiratory droplets are another way Nipah spreads between people. When an infected person coughs or sneezes, they release tiny droplets into the air. These droplets can contain the virus. If someone else breathes in these droplets, they can become infected. It's especially important to be cautious when caring for someone with Nipah. Wearing protective gear like masks and gloves can help prevent the spread of the virus. Section 5. Staying safe from Nipah. The good news is there are steps we can take to protect ourselves from Nipah virus. This virus, which can be transmitted from animals to humans, can cause severe illness. However, by following some simple yet effective measures, we can greatly reduce our risk of infection. One of the most important steps is practicing good hygiene. This is a fundamental practice that can help prevent not just Nipah, but many other infectious diseases as well. This means washing our hands frequently with soap and water, especially after being in public or around animals. Hand washing should be thorough, covering all parts of the hands, and should last at least 20 seconds. Another important precaution is avoiding contact with bats and pigs. These animals are known carriers of the Nipah virus, and close contact with them can increase the risk of transmission. If you live in an area where Nipah is present, be careful around these animals. It's best to observe them from a distance and avoid any direct interaction. Don't touch them or go near their habitats. This includes avoiding areas where bats are known to roost or where pigs are kept. If you eat fruit, make sure it's clean and hasn't been touched by bats. Bats can contaminate fruit with their saliva or urine, which can carry the virus. Washing fruit thoroughly before eating it can help reduce the risk of infection. Use clean water and, if possible, a brush to scrub the surface of the fruit. By taking these simple precautions, we can significantly reduce our chances of contracting Nipah virus. It's also important to stay informed about the latest health advisories and updates from health authorities. They can provide valuable information on any new outbreaks and additional measures to take. Staying informed and vigilant is key to protecting ourselves and our loved ones. Remember, prevention is always better than cure. By being proactive and cautious, we can help keep our communities safe from Nipah and other infectious diseases. Community health workers play a crucial role in spreading awareness and educating people about the risks and preventive measures. Supporting their efforts and participating in community health programs can further enhance our collective safety. Ultimately, maintaining good hygiene, avoiding contact with potential carriers, and staying informed are the best ways to protect ourselves from Nipah virus. Let's all do our part to stay safe and healthy. Section 6. Nipah outbreaks around the world. The Nipah virus, a zoonotic pathogen, has been responsible for several outbreaks across different parts of the world, causing significant concern among global health authorities. Nipah virus has caused outbreaks in several countries, each with its own unique challenges and responses. The virus, which can be transmitted from animals to humans, has led to severe illness and high mortality rates in affected regions. One of the first identified outbreaks occurred in Malaysia and Singapore in 1998 and 1999. This outbreak was particularly devastating, leading to widespread panic and significant economic losses, especially in the pig farming industry. Pigs were the primary source of infection in this outbreak. The virus spread rapidly among pig populations and subsequently to humans who were in close contact with these animals. This led to the culling of over 1 million pigs to control the outbreak. Bangladesh and India have also experienced repeated outbreaks of Nipah virus. These outbreaks have been more sporadic but equally deadly, with high fatality rates and significant public health challenges. In these regions, the virus has been linked to the consumption of date palm sap contaminated by infected bats. Bats, which are natural reservoirs of the Nipah virus, often contaminate the sap with their saliva or urine, leading to human infections. These outbreaks highlight the serious threat Nipah virus poses to global health. The virus's ability to cause severe respiratory and neurological symptoms, along with its high mortality rate, makes it a significant concern for health authorities worldwide. They also emphasize the importance of surveillance and early detection in containing the virus. Effective surveillance systems can help identify outbreaks early, allowing for prompt response measures to be implemented, thereby reducing the spread of the virus. By studying past outbreaks, scientists and health officials can learn valuable lessons about how to prevent and control future ones. Research into the virus's transmission dynamics, animal reservoirs, and potential vaccines is crucial in developing strategies to mitigate the impact of future outbreaks. Collaboration between countries and international health organizations is essential in sharing knowledge and resources to combat this global health threat. Section 7. Stopping Nipah before it starts. Preventing Nipah virus is crucial. One way to do this is by reducing contact between humans and infected animals. This can involve keeping bats away from fruit trees and pig farms. Another important strategy is raising awareness about Nipah virus. Educating people about the virus, how it spreads, and how to prevent it is essential. Early detection of Nipah cases is also crucial. This allows for prompt isolation and treatment of infected individuals, limiting the virus's spread. By working together, we can prevent Nipah virus from becoming a wider threat. Section 8. What to do if you think you have Nipah. If you suspect you might have Nipah virus, it's essential to seek medical attention immediately. There's no specific treatment for Nipah, but early supportive care can make a big difference. Doctors can monitor your symptoms and provide treatment to manage fever, breathing difficulties, and other complications. Early detection and care can significantly improve your chances of recovery. It's important to inform your doctor about any potential exposure to bats, pigs, or infected individuals. This information can help them make a quicker and more accurate diagnosis. Remember, prompt medical attention is vital if you suspect you might have Nipah virus. Section 9. We can all help fight Nipah. Nipah virus is a serious public health threat, but by working together, we can control its spread and protect ourselves and our communities. By understanding how Nipah spreads, practicing good hygiene, and seeking prompt medical attention when needed, we can all contribute to the fight against this dangerous virus. Remember, knowledge is power. The more we know about Nipah virus, the better equipped we are to protect ourselves and others. Let's work together to stay informed, stay safe, and stop Nipah in its tracks. Together, we can make a difference.